So it's 8 a.m. UK sharp. Dr. Farooq, do you want to start sharing your screen while I'm introducing you? So Dr. Muhammad Asif Farooq is an associate professor at NAS, which I think is #1 university in Pakistan. Maybe some others disagree, but I think that is what I heard. I know Dr. Farooq from previous year when he was visiting Coventry University. We had a very great time, and he gave a very nice talk here. So I thought of inviting him here as well to inspire some of our future Kharazmis. So Dr. Farooq, please go ahead.
Thank you very much, Amir, and thank you to the organizers for inviting me to this conference today. Conference. So it was really pleasant to present my work over here. So the title is Pins for Artery Disease Detection. And this work has been done with my PhD students and the bachelor students. These are Rashid and Sadaf, are bachelor students. They are graduated recently. Let me just briefly give you the motivation of doing this work. When someone has a problem in heart problem, the doctor give them the CT scan and MRI testing. So what happened is that during the CT scan and MRI, the resolution near the boundaries, near the arteries, are not very much visible. So we missed maybe some of the details there. On the parallel, the scientific community were working on the computational fluid dynamics to find out the disease in the arteries. So what in the arteries, but the problem with CFT is it is very expensive. It is not only expensive, but it is also time consuming. For example, doing the CFT work for the current problem, sometime we needed almost 10 hours to complete the project. So recently, as everyone knows now, the emergence of machine learning, we moved into the scientific community, moved into the machine learning thing, so that they try to minimize the computational cost and also the time consumption. Maybe the computational cost is the same as before, since you have to train the data, but when it has been trained, then you can save the time. So here we are using the machine learning, which is actually a PINS, physics-informed neural networks for the artery disease detection. This was the brief motivation of doing this work. These are the contents. First, I will give you the introduction, then the governing equation, since we need to work on the governing equation for the blood flow in the arteries. Then we have physics-informed neural network, machine learning. Then we will talk about the results and discussion, followed by the conclusion, future work, and the references will be given at the end. So it is, unfortunately, there are many heart-related patients in the world, and they are increasing day by day due to their lifestyle. And approximately 18.6 million people die due to the heart-related problem. We commonly call the disease related to due to the heart problem. We have CVD, cardiovascular disease. That is the common name that we use in scientific community. According to the BHF, British Heart Foundation in UK, around 0.1 million people actually died in 2019, and still 6.4 million people are living with the CVD. What is the reason of many cardiovascular disease patients, not only in each country, but also in all over the world? The reason is your lifestyle, the food you eat, it contains cholesterol and oil and other things. When it mixes with your blood and moves into the arteries, then that artery not suddenly, but after gradually, it stops the blood flow in the arteries. So there is a plaque in the arteries. So it is due to the food that we eat. Since we are working in the aortic aneurysms, so let me first define what is aorta. Aorta is the main vessel which actually is responsible for transporting blood from the heart. You know that the heart is your engine. It is a kind of engine which transports blood to all the organs of your body. So it should be healthy enough to transport and extract to transport the blood to all the organs. Now, what is aortic aneurysm? Aortic aneurysm is the balloon kind of thing in your arteries. It actually happens due to the weakening of the arterial wall. When these walls become weak, they try to expand. When they expand, this becomes abnormal bulge, and that is the aortic aneurysm. In this study, we are interested in thoracoabdominal aneurysm. In fact, we have divided the aneurysm in. We have considered two aneurysm. One is above the diaphragm, and one is below the diaphragm. Okay, so that is called the thoracoabdominal aneurysm, and I will show you the picture of thoracoabdominal aneurysm. You can see that here we have a diaphragm, and on above we have, for example, we have we have thoracic aorta, and on the below we have abdominal aorta. Am I audible or the screen are visible? Someone is commenting. I don't know. Amir, is it visible?
Yes, I can see the slides and I can hear you.
Yeah, sure. Someone commenting, so I hope this is fine.
Yes.
So we have thoracoabdominal aortic aneurysm over here. Not here. It is not shown over here. Here I have just give you the thoracic aorta and the abdominal aorta, which is over here. So, for example, we have this aorta. You can see the aorta, and here we have this one aneurysm. This is ascending aorta, and here we have aneurysm. Then we have aneurysm over here, balloon kind of thing. And then we have aneurysm over here. So that's how the aneurysm looks like when someone has a problem in their aorta. There is another phenomena which is common, which is stenosis, which is actually a blockage. Stenosis is important, but you can remove that by putting the stents into the arteries. But the aneurysm, it is very dangerous. So when it ruptures, then you actually, the patient can die. So it is very important to identify the aneurysm and when it actually ruptures. So here you can see the healthy aorta, and then you can see the aneurysm, which is the one-sided aneurysm. And then we have a football type aneurysm, American football is this is the axisymmetric aneurysm. So we will talk about these two aneurysm in this presentation. So what is the aim of this project? The aim is to investigate 6 cases of axisymmetric, and asymmetric cases over here. Then how can we identify whether a patient have a aneurysm or some problem in the aorta? We calculate the wall shear stress and wall shear stress gradient, and then we calculate von Mises stress distribution. And at the end, the main motivation is to automate the process. For example, if you give me the CT scan and we try to help the doctor by putting that CT scan to the pins, and we can identify whether a patient have a problem in his or her heart or not. Briefly, let me just talk about the literature review. Kashyap talked about the coronary artery disease and CFT, and Lee et al. In their research, they discussed CAD, coronary artery disease, and deep learning and CFT. Pinto discussed in their paper about the coronary artery disease and CFT, and Biglarian et al. Talked about the coronary artery disease and CFT work. The idea of giving this literature review to you is that most of the work has been done in CFT and CAD. As I already talked about that, the CFT is expensive computational fluid. Although when you don't have a solution, then you at least have a solution from CFT. But now it is, we know that it is expensive. And you can also see that some other literature, that CFD and machine learning. So most of the work has been done on CFD, but recently after 2021 or maybe later, maybe earlier, and now people are moving towards the machine learning to find the solution of aneurysm and stenosis, and maybe in other research areas as well. So we can see that in this, from this literature review, the history of the work in this direction, we have what is missing in the literature. The missing part is we have the CFD analysis for the asymmetry, and the symmetric cases for laminar and turbulent flow was missing, and which we published this work in the Chinese Journal of Physics, which I present to you now. And then the very few work has been done for pins with CFD. Okay. These are the cases that we discuss in this work for aortic aneurysm. The case 1 is, there are 2 subcases for every case. One is L. L means the laminar and turbulent flow. The turbulent is very much dangerous. If it develops in your arteries, then the arteries can be ruptured, or it can damage that artery as well. So the case 1 is all about the laminar and turbulent flow, and you can see there is a ratio of R over capital R, which shows that how much the symmetric or asymmetric the aneurysm is. For case 2, we have asymmetry, and we also discuss laminar and turbulent flow in that case with the beta, which is the ratio of R over capital R, and it has the value of 2.08 and so on. So case 3 is the similar asymmetric case. This is over geometry that we discuss in the paper, and I present to you over here. We have 2 aneurysms. One is thoracoabdominal aneurysm above the diaphragm, and one is abdominal aortic aneurysm below the diaphragm. And then we have, for example, asymmetry in case B and case C. What you have seen previously over here, this beta, Beta, if you just visualize it, it is the ratio of R over capital R. When R and capital R are equal, then we have a symmetry, and we discussed that in case 1. Governing equations. Remember that you cannot work alone in pins. For pins, you also needed a data from CFT. Raisi and other who have introduced the pins, whenever they show pins to in other subject areas, they also needed CFT data to predict, to compare as well. So we needed to work on CFT as well in parallel. So first equation that we needed is the continuity equation. In fluid mechanics, we call it the conservation of mass. Then we have X momentum, Y momentum, and Z momentum equations. Since this is a 3D problem, we have 3-dimensional erotic aneurysm. And we also needed some equations relevant to the turbulent flow. Turbulent flow equations are the extension of the momentum equations. What we have over here, we have the same continuity equation, but we also should add some extra term, which is shown in equation number 6, and their relationship with S and the velocity is given in the equation number 7. These are the equations for turbulent flow. So in our model, we have laminar and turbulent flow. Then for turbulent flow, we need to calculate the eddy viscosity, which is given over here in equation number 8. And for turbulent flow, we use KW model, which is the turbulence model that we use over here. And this is given in equation number 9 and 10. So here, a few terms, GK and GW are the production of turbulence kinetic energy and also the specific heat dissipation rate. And there are some other terms as well, SK and SW. These are the source terms, and so on and so forth. And we also added for the novelty. You know that when we have blood flowing in the arteries, that blood pushes the arteries wall as well. If your artery is not is flexible, then the blood pushes the artery wall, and the artery wall pushes the blood as well. This phenomena is called the fluid structure interaction. For that fluid structure interaction, we need to work a little bit more than the previous one, and we need to add the fluid structure interaction equation as well. And the equation 11 is for the fluid structure interaction. Since the fluid pushes the wall by the pressure and the viscous forces, so we need to add the pressure and viscous force. This is actually the Navier-Stokes equation, but applies normal to the wall. And UM is the velocity of the structure, and rho S is the density of the structure, which is the arterial wall. Equation 12 is the very famous law coming from the solid mechanics, that is actually stress-strain relationship. Then we also have some governing FSI equation as well. It is given in equation number 13, 14, and 15. The boundary conditions, you need to put the boundary condition for the diastolic phase and systolic phase. Diastolic phase is that phase in which the blood is entering into the heart. And in that phase, we have parabolic inlet velocity, and we can calculate the Reynolds number, which is 300. So we need to apply the laminar flow in diastolic phase. And for the systolic phase, we need to apply the turbulent flow, since the Reynolds number that we compute is 4,500. The hemodynamic parameters, the important parameters in this study are the wall shear stress that we compute at the wall, And there is another parameter that has been introduced by Lee et al., and that is called the wall shear stress gradient. Then we also have another parameter that is needed to identify whether a person has aneurysm or not. We calculate the von Mises stress component that is defined over in equation number 18. One term is missing, that is actually sigma xz square. CFD has been done in the ANSYS Fluent commercial software with built-in equations with upwind depressing scheme, and the residual error is 10 raised to power minus 4 for laminar case, and 10 raised to power minus 3 is for the turbulent case. Okay. Here, this is the grid independence study. First, you cannot work directly into the ANSYS and find the solution. First, you need to do the grid independence test, which shows that as you increase the number of cells, then your solution looks the same after some time. So you calculate the wall shear stress gradient over here. And we can see that when we have 8 million cells, which is a large number of cells, for 8 million cells, our solution wall shear stress looks the same. So we calculate all the future results for 8 million cells. This is the same grid independence study. So let me just talk about physics-informed neural network. This was the recent idea introduced by Raisi in 2019. 2017, I guess, 2017 or maybe 2019. So what we have over here, we have first we have a neural network, and that neural network has input as X, Y, Z. If you have a time, then you can give this as a X, Y, Z, and T. Then the output is your three velocities, U, V, and W, and then we have a pressure as well. So this is the neural network's calculation. And after that, we put, after maybe in intermediate steps, we also have activation function apply on this expression as well, which is the affine linear transformation. W is the weight matrix of weights, and B is the bias term. It is become very common. Those who are working in artificial neural network, they know that these are the equation that has been used in artificial neural network. So first of all, you have artificial neural network. You need to understand the artificial neural network, and the result of that has been put it into the physical laws. In our case, these are the governing equations, Navier-Stokes equation, and so on. For example, the first one is equation 20. It is the loss function. Why this is a loss function? U, P, and you have calculated that from the neural network and then calculated the derivative, all the derivative, and put it into the Navier-Stokes equation, which is given in 20. Then you have boundary condition. You put it your solution U into the boundary condition. You calculated the loss. Then at the end, you computed the solution from the pins, and compare this with the CFD data in equation 22. We have combined the 20, 21, and 22 in one loss function. That is the final answer of pins. These are some details which I already explained. We did this in PyTorch, and input is X, Y, Z, since there is no time. We did work on for time dependence in the future work. We already published that paper. This was the paper when we have without pulse style flow. So X, Y, Z is the input, and P, U, V, W is the output of the neural network, and so on. For the pin, we have 10 hidden layers, and each layer contains 256 neurons. And these are the activation function. So this is the result. For example, you can see that on the y-axis, we have the velocities. First, we want to show you the velocities, how the velocities behave in the aneurysm. Where is the aneurysm over here? The aneurysm is over here at this position from 0.1 to 1, there is an aneurysm. Since the velocity has been slower down in the aneurysm velocity slows down, and then when aneurysm ends, then the velocity increases, then it also stops. The reason is there is another aneurysm over here. Then these are the streamlines. You can see the recirculation. The recirculation actually makes the fluid slow. Since it is aneurysm, it has more space to move. So there is a recirculation over here and recirculation on the right figure as well. And these are some of the cases for case 2L and 2T as well. These are the same thing. Okay. And these are, you can see the recirculation is in the aneurysm. Here, this is important, how we identify whether the person has a aneurysm in a patient has aneurysm or not. The parameter that we compute is the wall shear stress, and you can see the wall shear stress has a less value over here. Then, for example, it increases, and so we have two aneurysm, and the wall shear stress value is higher. Then we have lower value, so we have the aneurysm identified by this image for all the cases. This is the same for wall shear stress for different planes. We can see that there are two aneurysms over here. One is this one, another one is this. Then the velocity is wall shear stress is higher, since wall shear stress depends on the velocity gradient. If the velocity is higher, the wall shear stress is higher, and so on. The velocity is slow. In aneurysm, velocity is slow, wall shear stress is lower. This is the comparison. I will only show you three comparison only for 6 cases. For case 1, for example, you can see these are all the results from CFT, and these are all the results for PIN. And this is the mean squared error, normalized root mean squared error. So we can see the good agreement, but not as good as we have recently in our recent published paper. For example, here you can see that the red line, the red area, the dark area is less dark, and this one is more dark in PIN. This one is case 2. So we have good comparison over here. Mean squared error is low. Here it is a bit high. And in this case, the mean squared error is also low. So this is case 3. Maybe you can see the comparison. I will move forward and reach at the conclusion. So in this work, we have worked on CFT and physics-informed neural network for thoracoabdominal aneurysm. And we calculated the important parameters, wall shear stress to identify the aneurysm, wall shear stress gradient, and we also calculate von Mises stress distribution or von Mises stress. And we work on laminar and turbulent flow for both the cases, and fluid structure interaction has also been applied in this research. And the important part is the PIN result. The PIN result, we have compared the CFT and PIN result. They show the good agreement. Sometimes there is some problem, but other time, most of the time, we have a good comparison over here. So these findings actually give us the monitoring and potential intervention strategies for aneurysm configuration, and we can help the doctors by such kind of studies. So we are currently working on variable size diameter aneurysm. The CFD part has been almost completed, so the PIN part will be done in the future. So thank you very much. These are the references.
Okay, thank you, Dr. Farooq, for a very nice talk. If anyone from the audience has a question, please raise your hand and we'll call your name to unmute yourself. Any question from the audience? Said, please go ahead.
Thank you, doctor. And I have a question. Do you think your work can be used to study flood areas of rivers?
I'm sorry, area of?
Areas of rivers.
think he said flood areas of the rivers.
Rivers, yeah. Why not? People are working in pins. I mean, this is internal flow, blood flow in the arteries. So if you want to work in river, you can do that. You can apply pins. I think you should look at the paper of Raisi. He has shown work on the geophysics and some other areas as well.
And one question in the chat, but we have to be very quick. From Mashal Nagin, she said, in aneurysm detection
aneurysm.
and risk level detection, how do pins compare to traditional biomarkers?
Traditional
Biomarkers.
Yeah, pins is very in the beginning it is expensive, but when you train the data, then you can easily get the answers compared to the traditional work in CFT, which I already talked about in the presentation. So pins is all focus is on pins nowadays.
So I think we have to move to the other speaker, 8:31. Thank you, Dr. Farooq. Maybe we can use this React clap from the thing.
Thank you very much, Ahmed. Thank you.